Well, thank you very much for joining us today. I'm Todd Duhamel. I'm now the director of the Health Leisure Human Performance Research Institute, which is a pan-university research institute that's housed within the Faculty of Kinesiology Recreation Management. This week we have the honor of having Peter Katzmarzyk join us from Pennington Research Institute. Peter has a long history of working in physical activity and epidemiology, obesity research. He has an extensive dossier with over 400 publications. And most notably, and this is really important for both Peter and for our faculty, is that Peter's the 2016 Samuel Weiner Distinguished Lecturer at the University of Manitoba. So we've brought Peter in, and he's delivered a series of research seminars, public lectures, and then also some opportunities to interact with healthcare providers at one of our partners at Seven Oaks Hospital, the Wellness Institute. Today's forum, we've partnered with Winnipeg in Motion and also with the Physical Activity Coalition of Manitoba to have this public topic. The presentation that Peter's going to make is going to be a bit short at the beginning, but that is because we instructed him to keep it to about 5 minutes and a minimum number of slides. And the format after that will be that there'll be question and answer period, so it'll be your opportunity to interact with him. So a really important part of this distinguished lecture series is this public opportunity to interact with an expert. And as far as I'm concerned, Peter's one of the best in the world in this kind of area, and his dossier supports that. So we've pulled up your slides for you, Peter, and if you can talk for about 3 to 5 minutes on what your research is and the 24-hour movement guidelines, that would be very helpful.
Sure, all right. Well, thank you for the opportunity to be here today and talk about the 24-hour movement guidelines. This is kind of a novel thing. It's been developed in Canada, and it's right now for children and youth. We don't have 24-hour guidelines yet for adults, but we may be moving in that direction. So, you know, you can't read this, and it's not important, but what it says is, you know, it's physical activity guidelines for Americans. And we used to have physical activity guidelines for Canadian children as well that were specific to physical activity. And that has been the focus for years and years and years. You know, the public health impact of physical activity. So traditionally, from exercise physiology origins, we've been really concerned about moderate to vigorous activity. You know, physical activity that would increase your fitness, improve your health. And that's why our public health guidelines were always related to moderate to vigorous activity levels. You know, like 3 to 5 days a week at a certain intensity and a certain duration. However, now, there's greater interest in understanding that 24-hour period of the day. So if the guidelines are 60 minutes of moderate to vigorous activity for children, what do we do about the other 23 hours of the day? And that was kind of the genesis of the 24-hour guidelines for Canadian children and youth. And so the group at CHEO, under directorship of Dr. Mark Tremblay, kind of spearheaded these 24-hour movement guidelines in Canada. And this was just from a paper by J.P. Chaput from CHEO, just showing, you know, if you were to break up the entire 24-hour period, you know, we have things such as sleep, we have light activity, moderate to vigorous, and then a big chunk of the day, which is sedentary time. Around the same time, groups in the United States, this group from Stanford was also thinking along the same lines. Now that we have these wrist monitors everyone has, you know, the Fitbits and Nike Fuel Bands and all this kind of stuff, we can measure behavior over 24-hour periods. So they were trying to now measure, you know, sleep, exercise, light activity over 24 hours. So now that we have the capacity to measure it, what are the health implications? And so I was involved with the development of the 24-hour guidelines. As I said, you know, Mark Tremblay and CHEO and was kind of leading it with Sept. However, they did bring in some international folks. So I came in from the United States. We had someone from England, and we had someone from Australia as well. And so we had a timeline since October 2014 through to their release this June of development. You know, we developed the guidelines over time using systematic reviews, looking at the best available evidence in the scientific literature, to the point where we've now published these 24-hour guidelines for children and youth. So they don't just consider activity, they now consider the whole spectrum of movement around 24 hours. So they encompass, this is the moderate to vigorous activity. Stepping here, we consider this just filling in the light activity throughout your daily life. A sleep component, and trying to reduce the amount of time spent sedentary. So it's a fairly simple message with 4 components, and it ties in sleep, sedentary behavior, light, and moderate to vigorous activity. So for physicians and pediatricians or anyone working with children, we now have kind of like a one-stop shop related to human movement patterns for kids. You don't have to go looking for sleep guidelines or whatever. It's all been integrated together. So that's essentially what we have now for these 24-hour movement guidelines. And we can leave this up too in case we have questions about that.
Okay, so Peter, maybe you can tell us a little bit about the research that informed this. Like, what kind of studies did you use to come up with these guidelines?
Yeah. So what we did, we undertook a series of systematic reviews in different areas. So there was a systematic review done on sleep and health. There was one for moderate to vigorous activity and health, one on sedentary, and there was one that looked at the combinations. So we looked at studies that actually investigated the combinations of different parameters, such as sleep and sedentary behavior and activity, and how those combinations went together to impact health of children. So essentially, we had a series of these systematic reviews that were done by experts across the country, which reviewed all of the available data. So these were largely cross-sectional studies. We had some randomized intervention trials, etc. But it was a way of searching the literature, trying to get our hands around these topics in a very systematic and a scientific way. And that is something that also separates these apart from other guidelines. These are evidence-based guidelines. They come from scientific evidence. It's not just, that we think it's a good idea that kids should get 60 minutes of activity. And that's what the evidence tells us.
So would it be fair to say Canada's leading the way with looking at these movement guidelines?
Absolutely. These, as I said, these are very novel. People around the world are paying attention now. There was a meeting in the United States recently to discuss this, about whether we may be able to incorporate something like this into the physical activity guidelines for Americans. But, Australia, United Kingdom, they're all coming around to this idea. And it's really groundbreaking. You may know this, you may not, but Canadians have always been at the forefront of physical activity guidelines for kids. We've always been just a step ahead of everyone else when we put out guidelines. It's a bit risky, perhaps. Sometimes we go maybe a little too far, but the evidence has always supported us, and we've always led the world, really, in guidelines for children.
I like the way you slipped that in there, a step ahead.
Yeah,
especially with the 24-hour movement guidelines.
Yeah.
At this point, what I want to do is I want to open up the conversation to questions from the audience. So Laura has a microphone. If you're interested in asking a question, we just ask you to stand up and use the microphone.
Thank you very much. I have a question really regarding the implementation of the guidelines. So there is quantitative pieces to the sweat, sleep, and sit. Mm-hmm. There is no quantitative piece to the step. Was that intentional, or is there kind of a target that you're thinking the step number should be? Us Fitbit users are kind of really always looking to quantify, and so that one seems to be something that, just a question I have.
Yeah. That's a great question, actually, and there's a reason for that. The two components that don't really have a solid number attached to them, as you said, are stepping, which is the light activity, and also total sedentary behavior, which is kind of a corollary of that, right? We don't have a true number on that. The sedentary behavior guideline is to watch no more than 2 hours of TV or screen time a day, which is one component of sedentary behavior. We still haven't got around exactly how many hours of total sedentary behavior is too much. And so that feeds directly into your specific question about the light activity. In the systematic reviews, we were unable to find any good quality evidence talking about a certain amount of light activity and health. So the guidelines around that really just say that we should be, replacing most of our sedentary behavior with light activity. Try to get out of that sedentary category, replace it with light, and even better, replace it with moderate to vigorous. So that light activity is kind of a catch-all place for everything else. So if you're not sedentary or active, you're in that light category. And we'd like you to minimize that as much as possible by increasing your activity. But over the years, as I mentioned at the outset, the focus has been on moderate to vigorous activity. And that's where all the research is. Unfortunately, we don't have very much research on light activity and health. So that's another call for this, that we want more research there. Maybe we can come up with a number in the future. But we don't have a solid number for that. Yeah, that's the reason why.
Hi, Peter, thanks. Just kind of curious about why the emphasis has been so much on children's physical activity and particularly sedentary behavior as opposed to understanding the implications of sedentary behavior for adults and older adults. Yeah. And when do you foresee those potential guidelines being actually developed?
Yeah. So as you know, within the Canadian context, they've kind of divided it out. We have physical activity guidelines, for children, and then a separate set of guidelines really for adults. In the United States, we only have one set for the entire population. And there's pros and cons to doing it both ways. Separating it out by children and adults and even older adults allows you to really message those groups in different ways. So we're starting here with 24-hour movement guidelines in children and messaging it towards the children. And one reason for that is that television viewing has been studied quite extensively and its relationship to health in kids. We don't have quite that evidence base in adults yet, but we're working on it. So I think very soon we'll start seeing more countries coming up with 24-hour guidelines for adults. And you mentioned the sedentary behavior part. We don't have really a single guideline in the world related to sedentary behavior in adults. None have come out yet. The Australians, in their guidelines, they say you should minimize sedentary behavior, but there's no number yet. We don't say 6 hours, 8 hours, 3 hours. So that's where we're moving. As you might know, the field of the sedentary behavior epidemiology is rather new. We had the first studies come out in 2008 and 2009, whereas for physical activity, we have 60 years of research. So we're moving towards sedentary behavior guidelines in adults. It's going to take, I think, a few years before we get there. We need more studies.
Hi, thank you. I was just hoping to get some clarification as to the systematic reviews and what you mean by children's health. What was measured? Because you're obviously not measuring cholesterol levels. Are you involving mental well-being? Are you involving weight? What is children's health?
That's a great question. We took a very broad approach to children's health, and so we kind of divided it into different areas. Some of those were mental health. We also did look at biochemical parameters such as cholesterol and glucose and lipids and these sorts of things, as well as blood pressure and adiposity. So we looked at the relationship between these characteristics and obesity and the development of obesity in kids, and some of the other physical health characteristics, as well as mental health. So the systematic reviews were divided into sections on each of these topics. So for example, sedentary television viewing and obesity. We would have an entire section where we looked at all the studies there and summarized them. What is the relationship between TV viewing and obesity in kids? And there might be another section on sedentary behavior and blood lipids or something like that. So it was done systematically, and the group of experts that put this together, they identified all the different facets of health that they felt were important.
Playing a little past the microphone. This is good for people's activity to do that.
Thank you very much. In relation to, I guess, outcomes, in the systematic reviews, how was physical activity measured? Was it by self-report mostly, or by objectively measured physical activity like accelerometers?
Yeah. It depended on the area and the outcome, and it depended on the amount of data we had. So where possible, we relied on objective measurements of accelerometry. In other areas where we didn't have that evidence, for example, the television viewing, that was all collected by questionnaire largely. But where we could find data on accelerometer measured activity, that's where we went. Yeah.
And just along that same lines, you mentioned that there's mostly cross-sectional evidence related to that. Are there any investments towards longitudinal studies that are looking at objectively measured physical activity in children and youth?
Yeah. It's similar to the US guidelines for children and youth. That evidence is largely still cross-sectional. We do have some short-term follow-up studies in kids where you would measure their activity at age 5 or 6 and follow them into adolescence. We don't have a whole lot of long-term studies with objective measures yet, but we try to include as much as possible that prospective evidence as well as evidence from interventions. That was the most powerful evidence. So if you were able to randomize children into an intervention with physical activity and look at the health outcomes, that's where we really had the best evidence. In other words, can reducing television viewing also reduce obesity? And those were the kinds of studies we look for. Yeah.
So Peter, one of the things I noticed about this is that there's really no description on how kids should be active, and like, should they be doing 60 minutes straight through, or they should be doing it intermittently. One of the things that I like to do with my kids is chase them around the backyard, which is very intermittent, stop, start, stop, start. Is there any guideline information on that, or is that something we still don't understand yet?
There's not a whole lot of evidence on that, particularly in kids. In adults, they say, it should be accumulated in bouts of at least 10 minutes. But that may actually be going away in the next guidelines because we don't know whether 10 minutes is the minimal bout of exercise that's required. And again, no one's really studied anything less. They haven't studied 5 minutes or 2 minutes or 3 minutes, so we don't know. And so in kids, it's the same way. We just want kids to be active. We want them to be outside, preferably in the fresh air, in the outdoors, and it says that down there. We want them to preferentially be outside because kids are more active when they're outside, and they have sporadic activity. They really do. So we want to encourage that. You can't take 5- and 6-year-old kids and just tell them to go running for an hour. The sporadic activity is good, and it's good for them.
Yeah, so that natural play is a really good recommendation, even though it's not evidence-based, and it's just the reality of what we're doing a lot of times. Yeah, and it's fun, so we should be getting kids to be doing that.
Yeah, that's the bottom line. Any activity they will do is the activity we should be promoting. And where, whether it's on land, in the water, whatever they want to do, as long as they're being active, that's where we want to go.
Okay, so we're looking for some more audience questions. Mr. Stammers.
Thanks very much for the talk. My question is going to be around evaluation. It'll build a bit on Scott's question. So we have trouble getting people to wear an accelerometer for more than 10 hours. So I'm wondering if you have any ideas about how we're going to assess how many kids are actually reaching these guidelines, and if it's going to be objectively assessed or a combination of objective and subjective self-report.
Yeah. Well, that's the next step, isn't it, right? We now have guidelines. The next question is, how are we going to use surveillance to monitor these guidelines in the population? For example, in the Canadian Community Health Survey or the Canadian Physical Health Measure Survey. And so we've given some thought to that. With kids, they do really wear accelerometers pretty well. We just finished a study in 7,000 children in 12 countries, and we had them wear a waist-worn actigraph for 24 hours a day for 7 days. And we had extremely good compliance. The kids liked wearing them, and they wore them. So that's one option. I think kids are a little different than adults. They tend to do things like that. The other way, the NHANES in the United States now has gone to wrist-worn accelerometers, which, there's pros and cons of that because we don't know exactly what it's telling us. But people will tend to wear those devices more so maybe than on the hip. So we can move towards surveillance with these 24-hour devices. And Stanford University, which I mentioned, they hosted a workshop around the 24-hour period and wearable devices this summer. And the whole thing was, how do we begin to measure this using the wristbands and that kind of thing? So that's where we're moving towards, is the surveillance of this 24-hour period. And that's kind of driven it a little bit as well. The fact that we can now measure it, we can now assess the health outcomes related to it.
Thank you. I'm just wondering, I was thinking a lot about how there's like all this technology out there for kids and things like Wii and Connect and things like that.
Yeah.
I'm just curious as to where activities like that would fit into this, where there's like the screen time as well as the physical activity in there.
Yeah, that's a great question, because not all screen time is the same. And so we're really talking about television viewing and sedentary type behaviors. If you're exergaming, using the dancing or the physical activity exergames, that would really fall under physical activity, because you're increasing your energy expenditure, sometimes to the level of moderate to vigorous activity actually in some of these games. So if you're actually playing them competitively and purposefully, that would be physical activity. So not all screen time is the same.
So let me build on that a little bit. So is all sedentary time the same? I read a paper recently suggesting that older people like playing cards, and they actually see benefit to playing cards even though it's sedentary per se. So are there such things as good and bad sedentary time?
There could be, and we're starting to tease that out. You can't really tease that out with an accelerometer. All you know is they were not moving. However, the questionnaire data tends to say there could be good and bad sedentary time. For example, television viewing is about the worst. Television viewing is related to the development of obesity, the development of type 2 diabetes over time, but it's confounded by the fact that you're in front of a TV. It's not just sedentary, you're actually watching messages that could be harming your health about going and buying certain products. And also most people are eating in front of the television as well. So it's a confound there. We find that in kids, TV viewing is most related to health. Things like doing homework or working on a computer or reading. Reading has never really been associated with health outcomes in kids. So there's more to be done there. It could just be the volume as well. People like to point to the fact that no studies have identified reading as being related to kids' health, but kids don't typically read for 3, 4, 5 hours at a time. So you're condensing that period of time. They watch television for that long, that's why it's bad. Maybe if you read Harry Potter for that long, it would be bad too, but who knows? We don't really know about that.
Hi there. So we've talked a lot about screen time and how children are more drawn to screen time. That's kind of what's decreasing this activity level. And you mentioned how outdoor activity is a bit more beneficial than being inside and everything. So my question is, are there any areas in the field trying to incorporate technology into the outdoors to draw kids outdoors to be more active and get their more steps, do their more physical activity?
Mm-hmm. There's a little bit of that. Most of our work at Pennington has been on the exergaming, trying to get kids to come in and exercise in front of the computer screen and that sort of thing. There are studies out there with those kind of virtual reality games where you have to track down certain things like the Pokemon Go and things like that. They're trying to develop more adventurous type games that can be done in the outdoors as well. We haven't really evaluated those yet. Like Pokemon Go is pretty much gone. But it may have a resurgence. There was a lot of activity and excitement around it when it first came out. Now no one's playing it, at least in Louisiana. But those types of things are being explored. Yeah.
I think there's some local examples we could cite too in Canada, particularly in Winnipeg. Fort White Alive last year developed a school system where kids can actually go to school in the forest and actually do it in January and stand outside -30. They actually go into the forest as a way to be away from the cold wind that we have here in the prairies.
Yeah.
Or there's some examples of outdoor schools in British Columbia where the idea is that you get these kids up out of desks and they're learning in different ways. It still follows a similar curriculum as what normally we have, but it's just delivered in a different way. So the idea would be is people are up and moving rather than sitting at desks all day long. It's still really early to be able to see if these are effective ways to change academic performance or even health outcomes, but there's a lot of different thinking about how do we get people up and moving in different ways. Yeah. Was there another question over here? If you have a question, just put your hand up really high so we can see you.
Hi there. I was wondering, just looking at that diagram and the split of it, our days for children as well as adults in terms of work or school life, our day is divided a lot more sitting time. And so I would like to see, I would just like to know how would you like to see these guidelines, where do you want to see the change in the mandates or how the day is structured for individuals? And how do you get that message out there? I'm looking more about the knowledge translation. Once these guidelines are set, how do we go about changing people's days?
Yeah, that's really tough because, as you know, we're forced into these kind of forced sedentary behavior lifestyles for school and work. We really need to, though, emphasize that we need to reduce those components of the day. So it's shown here as a very small component because that's kind of what the recommendation is. That's what the evidence tells us we should be doing. We're not doing it, but we should be doing it. So hopefully these things will translate. And a large component of the day is right in the middle there, right? The sleep component. And this is really novel where we brought the sleep researchers in to talk to the physical activity researchers. We never really considered sleep before. They never have really considered sedentary behavior or physical activity. Because we understand now that shorter sleep duration in kids, is linked to obesity and the development of weight problems. So we need to also balance out the entire, day. And again, this is an average. I want to emphasize that. We don't want to be so prescriptive that you have to get this every day. On average, we want kids to follow this kind of healthy lifestyle. And with sleep, it's important to try to get regular bedtimes. That is also healthy. But beyond that, we're not saying you need to go out and do 60 minutes this day, 60 minutes. On average, that's what we need to work towards.
Well, you mentioned physicians at the beginning and them getting the message so that they can impart these guidelines. Mm-hmm. I think it's important for parents to know we will be guiding their sleep, we will be guiding television viewing. But how do we get the message out there to perhaps school administration, like administrators, high levels, who would decide a change in the balance from sit to at least set a step and if not more sweat? How do we get them to change? And I realize it's not based on your research, but how would you like it to progress?
That's a great question. I mean, we need to somehow get the message into those audiences. When we developed the guidelines, we actually had an adolescent and her mother was on our committee. So they actually sat with us as we worked through this. We also had pediatricians and sleep researchers on the committee. And they also did a number of focus groups throughout the communities to try to get their input. So we're trying to get their input, but I think your question is more on how do we get it out to the other audiences? And I'm certainly not an expert in that, maybe others are, but we need to widely distribute these, get the message out there. Did you have a comment on that or a question?
A question up here, Roy has one which I think will build on that.
Yeah.
A big part of the knowledge translation strategy needs to be partnering. So these guidelines were created by an expert panel that were part of Canadian Society for Exercise Physiology, but there's a partnership with Participation to be able to do news releases and get them out there and to actually get people living them the best we can. There's also organizations at the provincial level that are acting on these. Physical Activity Coalition in Manitoba actually, this topic was selected by them, and through our partnership, they actually put the title forward, and we thought, that's a great opportunity to be able to talk about these more. So Roy, did you have a question or statement?
Well, I just wanted to make a comment about when you talk about how we distribute this information, and when the guidelines came out this year, they were released in conjunction with Participaction's annual report card on children and youth physical activity. And I just happen to have a copy of the report card here. But each year they go to a different topic related to the report card to kind of help promote it and that sort of thing. This year the focus was on sleep and how that relates to physical activity. So I just wondered, Peter, if you wanted to say anything about the relationship between the guidelines and what happened with participation this year in that focus.
Yeah, I think it was not a coincidence that happened, because the Children's Hospital of Eastern Ontario Healthy Active Living group, they were integral in developing this message, but they also are the research group for the report card. And participation was at the table here as well. And so they thought it was a great idea to promote the new guidelines by focusing this year's report card on the 24-hour period and on sleep, and try to really kind of boost that message and get it out there, because we know that the report card has great media uptake, and so we thought we could piggyback on that and really try to get the message out there to everyone. So we'll see. And some of the pediatricians that were on our committee, they thought it was a good idea because, they may not have expertise in physical activity and sleep and these sorts of things, and they don't know where to go for the guidelines. So now that if they come in and they see something, they can ask the parents about how much sleep they're getting. Is their sleep disrupted? Do they have a TV on in the bedroom? Is there too much ambient light in the room? Do they have a regular bedtime? So it's now embedded right within the guidelines. So they can ask those questions and maybe correct some of that.
And just another comment, I'd say that the CSEP website has quite a few resources around the guidelines. There's the webinar, there's some of the articles that were written when the guidelines were released, and it's a good resource in terms of getting a lot more information about the guidelines, how they were developed, how they can be used as well. So just wanted to mention that.
And also, this year's CSEP conference in Victoria, there's going to be a symposium on these guidelines. So we'll be talking to all the exercise scientists about this, and hopefully, like the Canadian Pediatric Society and things like that, they can bring this to their annual conferences and start kind of disseminating it.
Some questions in the back? Dr. Cornish?
Thanks, Peter. I'm just wondering how you would see exercise professionals utilizing these guidelines now to counsel people.
I think it might broaden their mandate a little bit now too. Just like we talked about the pediatricians, now instead of just counseling about increasing moderate to vigorous activity in kids and designing programming around that, we should be thinking a bit more about designing programming around reducing sedentary behavior and maybe improving sleep as well. So I think this sort of integrated approach kind of broadens the scope of practice for everyone. It doesn't narrow it, it actually expands it. And this is probably a good thing, because kids may not come into contact with all of these different domains. They may not see a pediatrician every year. They may not see some sort of exercise scientist or an interventionist. But if at least they see one of them, then they may get a more general message here.
I think beyond broadening the scope of practice, though, is one of the important things that can be done out of this is it changes the dialogue. The questions that exercise professionals should be asking should be more broad. Promoting physical activity, even at light intensities, is part of this for the STEP part, I think. And really, when you're looking at your clients, it's difficult, and we know that the evidence shows it's difficult to get people moving more where they're sweating a lot, right? People don't necessarily always like doing that. So there's a continuum of movement, which is what I really captured in this whole thing. So changing that dialogue and finding out where your client is on that continuum and how you get them maybe moving towards one direction is really critically important, I think. And it changes the type of questions in the discussion you have with them. Yep. Is there another question? One in the back there?
It's taken me a while to try to formulate this question in my mind. Just building on an earlier talk in the week about health equity and equity affected populations. the question about who is part of the panels and so on and so forth that helped with the guidelines. You talked about a lot of different specialists and a lot of different groups, but was there anyone that sort of represented an equity-affected population that sat at the table? Because in physical activity promotion, it's definitely an area of interest for ours, how to reach those equity-affected populations or populations of, experiencing poverty. Yeah. And sometimes we're just really faced with the relevance of promoting physical activity when they have so much else going on in their lives. And so I don't know if you've had any feedback as to how to reach those populations, or were they involved in the development of the guidelines?
That's a good question, and I'm sitting here thinking, going around the table, I don't recall anyone with being there from a particular health disparity group or something like that. I remember we had the student representative and her mother, and we had the pediatricians, and I think some of that was captured in the focus groups, though. I think we had a broad representation in the focus groups that were held across Canada that flowed into this. I may be wrong, but I can't remember a particular person that represented that group at the table. Yeah. And I haven't heard any feedback about that either. Maybe others have, I don't know.
Question up here. Build on that a bit, that health equity or accessibility for diverse populations to healthcare settings or health promotion settings is really something that's coming to the forefront in Manitoba, particularly. Maybe that's something that we can send back with you to think about next time around.
Yeah, absolutely.
Yeah. Good. Letitia, you had a comment.
So in line with that comment, and also your presentation on Monday, where you really had us question our assumptions, do you think that these guidelines apply equally to all groups, racial or gender-based, or any kind of groups there are out there? And if so, what the evidence says about that?
Yeah. I believe within the Canadian context that these are very relevant to almost every group, if not every group. We know from the literature searches we did that physical activity, was related to health outcomes in boys and girls, different ethnic groups around the United States, Canada, Australia. So there was no real ethnic difference in the associations between obesity or physical activity and obesity, or sleep, stepping, sitting. We looked for evidence of that, and we continue to do that now because we're now developing the new American guidelines, which will come out in 2018. And that is one of the overarching questions is, are there age, sex, or ethnic differences in these associations? And so far, we've really found none. Physical activity is one of those things that benefits everyone. We have studies in China, India, Africa, a bunch of different cultures, and physical activity is important for health across all of them. So I don't really see that being too much of an issue here, but time will tell. Time will tell. Yeah.
About that, do you think that we should modify the systems maybe we live in so that everyone can benefit from those interventions? So for example, if different groups of people do not get enough exercise or physical activity rather, how can we help everyone equally benefit from that?
I think policies do have a role to play here. One of them which kind of struck me as being off the wall was the school start and stop times. My daughter in high school, she had to be at her high school at 7:20 in the morning. And there are some jurisdictions now in Canada and other areas that are actually going to earlier and earlier start times, and this impacts sleep. So they say now that children have a shorter and shorter sleep duration, and actually starting school earlier is now further going to impinge on their sleep. So that's a policy intervention that we can develop. Let them start high school at 9 in the morning or 8 in the morning, like we used to have, not 7:30 or whatever. So there are policy implications that we can change the environment around these sorts of things. Absolutely. Yeah. And also we talked about the school environment. You were talking about the outdoor schools, and we have many examples now of school settings which are more active, where they can incorporate physical activity into the lesson. And I saw this in Louisiana. A school won an award because they were really active. They were on the track actually outside, and they were taking a math lesson. So every lap they had to answer math questions and do that kind of thing and move on through the cycle. So they were incorporating academics and physical activity in the same lesson. So we need to be thinking about these approaches.
One of the things we're talking about doing in one of our studies is actually talking and educating patients while we're walking on a track.
Yeah.
So there will be no sitting down education classes. It'll actually be active walking and discussing. So each lap you'll be given a different question to discuss as you take a minute or two to walk around the 250 meters or so. There's ways we can innovate to actually enhance academic learning.
So you're talking right now about enhancing the academic learning through physical activity and learning. Where does that leave people with physical disabilities who maybe aren't able to participate? Does that completely segregate them from having this kind of method of teaching, or where does that put them?
I'm not sure I heard that exactly. It was around having people with disabilities participate in physical activities?
So in the classrooms, you're saying that they're doing a lap for every question they get, right or wrong, whatever. Where does that leave people with physical disabilities that are maybe bound to a wheelchair that can't participate in those kinds of learning activities? Is there different programs that you guys are thinking of kind of incorporating with that, or where does it leave people with disabilities?
I can't speak to the Canadian context on that particular question, but we're just developing the US report card on physical activity and health for children and youth. And we've brought in experts on disabilities, and we've woven that through the entire report card, because there are a lot of opportunities. We just have to think in a novel way about that. And so most of the activities that are available are, like if someone was in a wheelchair, they can participate in most of these things. And there's a new initiative in the United States around inclusiveness, particularly related to physical activity. And they're working very hard at changing the curriculum to include opportunities for wheelchair athletes, or not just athletes, but children in wheelchairs and other groups like that. So there's more and more emphasis being placed on that. So in 2014, we issued the first US report card on physical activity and health, and that was a question around inclusiveness and disability. So in this next rendition, we've now included a lot of those folks, and we're getting a new perspective. So when we release our report card, you'll see that it's interwoven throughout the entire report.
A lot of the training programs that we have now across Canada are about teaching exercise professionals to be able to adapt activities to be able to suitable for all abilities. Some of our researchers in this facility are actually trying to take a diversity perspective on how do we make the experience of individuals that have different abilities, how do we get them more engaged with this facility, and how do we create programs to support them, because we want to be inclusive. And one of the parts of the website that I read this morning is that these guidelines apply to diverse skill sets or ability levels and things like that. So that inclusiveness is really fundamental in this.
What do you think that these guidelines are going to end up looking like for adults? And maybe a big question, but how do you suppose like our culture and our society and our world needs to be restructured so that we can make it happen?
I've been thinking about that myself, how we might apply this to adults, and whether it's necessary or whether it would have an impact. And it might. We haven't done kind of the formative research around that yet. In this situation, we're informing the children, but more importantly, we're informing the parents, particularly of young children who are trying to instill healthy lifestyles in their children. And so it's great information for parents, but I wonder, how much attention the adults would pay to such a prescription like this. And I don't know, maybe they will respond to it very well, but we haven't done that formative research. But it may look in a very similar way. We know adults should avoid sedentary behavior, they should increase their activity and get proper sleep. So I don't know what it would look like, and I also don't know whether it would be an effective tool to tell an adult, this is what you need to do 24 hours a day. It may be effective, I don't know. We'll have to wait and see.
Okay, so I don't see any more questions at this point. So maybe Peter, you give us some closing thoughts.
I thought I just did. Well, you know, I really think, you know, this really does demonstrate that Canada is at the forefront of this curve. It always has been, and it's nice to see that it's continued. We've had several generations of exercise scientists and public health professionals work on previous renditions of physical activity guidelines. Canada was the first country to have sedentary behavior guidelines for children as well. So it's nice to see us continue to kind of challenge that and to bring this forward. And we see, just like they're now adopting our thoughts on sedentary behavior, they're now thinking about adopting this. So it's great for Canada to be at this forefront, and I'm really proud of that. So hopefully it'll continue.
Yeah, and I think that it's really an awesome thing to see that research is being translated to be able to inform tools like this that can be used to inform policymakers in government or in schools or even exercise professionals. Like that translation of research into something that's translatable to people and how we actually do our jobs is really important. So thank you very much for sharing your knowledge with us today. Really appreciate it. Earlier this week, we gave you a small item of gratitude from the Health, Leisure, and Human Performance Research Institute. I'd also like to thank the audience for coming out and being part of our faculty kinesiology presentation that we're doing today. Our partner was Physical Activity Coalition of Manitoba for this presentation. Peter's giving one more talk tomorrow at the Bannatyne campus in Theatre B. And the Bold Ideas Symposium that's offered at that campus. So if you have an opportunity or an interest, tomorrow at noon in Theatre B at the Bannatyne campus. But beyond that, Peter and I will be around for a few minutes afterwards if you have any burning questions you want to ask. But besides that, thank you very much for coming.
All right, thank you.